Do you ever feel like you just can't get enough air? You're winded after carrying the groceries? It's easy to blame this on being out of shape or getting older, but what if this breathlessness is a way of your body telling you your heart is in trouble? Today, we're going to explore the vital link between breathing and your heart, and I'll help you understand when shortness of breath is a warning sign you cannot afford to ignore. Hello, I'm Joban Sehmi, a consultant cardiologist in Hertfordshire. I specialize in diagnosing and treating a full spectrum of heart conditions, including arrhythmias, heart failure, and coronary artery disease. A huge part of my work is helping patients understand the signals their body is sending them, and one of the most common and concerning symptoms is shortness of breath. Breathlessness is quite a non-specific symptom and can be caused by a variety of problems. In this video, we'll uncover why your heart is causing you breathing difficulties, the different ways this can feel, and how we as cardiologists investigate it to protect your long-term health. Why does your heart make you feel out of breath? To understand why a heart problem can leave you breathless, it's important to appreciate the incredible partnership between your heart and your lungs. Your lungs are responsible for bringing oxygen into the body, but it is your heart's job to pump oxygen-rich blood to all parts of your body, from your brain to your toes. When the heart muscle is weak, as in heart failure, it can't pump blood forwards effectively. This causes a backup of pressure within the lungs. If cars can't move forwards on the highway, they back up, causing congestion. This backup pressure forces fluid into air sacs, which are the tiny structures within your lungs where oxygen is normally exchanged. This condition is called pulmonary edema, or literally fluid in your lungs. Do you have breathlessness when you lie down? That's a major clue. It could be your heart. How can you tell when shortness of breath is related to the heart? This can relate to the lungs, it can be an anxiety issue, it can be because of low blood levels. And it's my job as a cardiologist to understand whether the breathlessness is coming from the heart or from somewhere else. So how do we decide that a breathing difficulty is coming from the heart and nowhere else? Breathlessness related to the heart typically does not occur at rest. So most patients feel very well when they're sitting or are not participating in physical activity. Depending on the severity of the underlying condition, moderate or mild levels of physical activity can cause breathlessness, but this breathlessness diminishes with rest. So any breathlessness that has an exertional component is highly suggestive of an underlying heart issue. Your body is demanding more oxygen when you exert yourself, but a weakened heart cannot deliver this. And that's the underlying mechanism for breathing difficulties related to the heart. The second symptom, and this is a major red flag, is difficulty lying flat. This is shortness of breath that occurs when lying flat, particularly at night time. Often patients report that they require 2, maybe 3 pillows to prop themselves upright to allow them to have a good night's sleep. This happens because when you lie down, any fluid that's accumulated in the peripheries, in the legs, the toes, etc., and driven back centrally towards the lungs and causes congestion. A related symptom is paroxysmal nocturnal dyspnea. Essentially, this means waking up suddenly in the middle of the night, gasping for breath. Patients often have to get up, either sit on the edge of the bed to make themselves feel better. This can be a symptom of a very significant heart issue. If you're experiencing these specific patterns of shortness of breath, especially difficulty lying flat or waking up in the middle of the night, gasping for air, it's highly suggestive that the heart is the underlying cause, and you really ought to see a cardiologist for further assessment. There are many heart reasons why patients may be breathless. The most worrying, and indeed the most classical reason for breathing difficulties is heart failure, but there are other reasons why patients may report breathlessness. Or an early symptom of narrowings in the arteries of your heart is breathing difficulties with exertion, and particularly more prevalent amongst women and patients who have diabetes, whose perception of pain may be altered. Another common condition that leads to breathing difficulties are problems with the heart valves. Think of the heart valves as gates that open and close within the heart. These heart valves will open 100,000 times every day, and they do that for several decades. But over time, their efficiency may reduce, so they become more tighter or they can become leaky. The first indication that this may be a problem is breathlessness. When the heart's electrical activity is altered, so the heart goes too fast or is irregular or chaotic, one of the first signs can be breathing difficulties, not necessarily palpitations or perception of your heart beating abnormally. Very rarely, the pressure on the right-hand side of the heart can be increased for reasons that are not necessarily very clear. And this condition is pulmonary hypertension. This can be diagnosed with a simple scan, and this is, again, a rare cause for shortness of breath. It is my job to investigate all these possibilities to find the root cause of your symptoms. Feeling breathless? Here's how a cardiologist finds the cause. When a patient presents with shortness of breath, I have a very systematic approach to trying to understand the underlying cause and arriving at a correct diagnosis. The most important part of this process is you giving me a detailed history. This involves telling me exactly what your symptoms are, when they began, any triggers, any relieving factors. I put this together with your past medical history and any family history you may have, along with lifestyle factors. The next stage is a clinical examination, listening to your heart and your lungs. We then move on to simple diagnostic tests. I start with an ECG, which is a recording of your heart's electrical activity, and this can give an initial clue as to the underlying problem. From an ECG, we can tell if the heart is enlarged, if it's thickened, or if there's any damage from a previous heart attack. The pivotal test when investigating someone with breathlessness is an echocardiogram, which is a simple, non-invasive ultrasound examination of the heart. If we need more detailed information to identify the underlying cause, then I may consider a CT scan of the arteries of the heart, looking for narrowings. In addition, a cardiac MRI allows us to accurately assess the heart structure and function, look for scarring, look for narrowings in the arteries of the heart, and look for inflammation. These tests help us pinpoint the exact cause of your breathlessness and allow us to tailor your treatment accordingly. We can treat the conditions that cause breathlessness. The treatment for breathlessness completely depends on the underlying cause. If the breathing difficulties are because the heart is not pumping effectively, then we have a plethora of medications that can effectively manage this condition and allow you to live a normal and fulfilling life. We have the 4 pillars of heart failure therapy, which strengthen the heart and make it work more efficiently. We have 4 diuretics that allow us to remove any fluid that may be retained within your body. If the cause is blockages or narrowings within the arteries of your heart, coronary artery disease, these can be effectively managed with tablets. Where tablets are ineffective, we can open up blocked arteries either with a procedure called angioplasty, with a balloon, or in extreme cases, bypass surgery. When the cause of breathlessness is significant impairment in valve function, then we have multiple treatments that can be effective. This includes medication for faulty heart valves, valve replacement or valve repair. We have specialized medications to reduce the pressure on the right-hand side of the heart and to improve the efficiency with which the heart contracts, relieving your symptoms. The goal is always to treat the root cause, which in turn relieves the pressure on the lungs and allows you to breathe freely again. Shortness of breath is a symptom that should never be ignored. While it can be caused by many things, when it is your heart, it can be effectively treated. If you'd like to book a consultation with me, you can do it via the link in my bio.